Have you ever noticed something unusual with your body and wondered if it was a minor issue or something more serious? It can be unsettling when your body behaves in an unexpected way, especially when it comes to sensitive health topics. One such concern many people silently worry about is bleeding after sexual intercourse. So, is postcoital bleeding a sign of cancer? While any unusual bleeding should always be evaluated by a healthcare professional, postcoital bleeding, which means bleeding after sex, is not always a sign of cancer. Many non-cancerous conditions can cause this symptom, but it is crucial not to ignore it. The reason this symptom warrants attention is that while often harmless, it can sometimes indicate more serious underlying issues, including cervical cancer. The cervix is particularly vulnerable to irritation during intercourse, and conditions like inflammation, infections, or benign growths called polyps can easily lead to bleeding. Hormonal changes, especially during perimenopause, can also thin the vaginal tissue, making it more prone to microtears and bleeding. In rarer cases, it can indeed be a symptom of cervical cancer, particularly in its early stages when other symptoms might not yet be present. If you experience any bleeding after intercourse, the most important step is to schedule an appointment with your doctor or gynecologist. They will likely perform a pelvic examination, which may include a pap smear to check for abnormal cervical cells, and potentially other tests like a human papillomavirus test or a colposcopy, where they look at the cervix more closely with a magnifying device. Be prepared to discuss when the bleeding occurs, how much there is, and any other symptoms you may be experiencing. This information helps your doctor determine the cause and recommend the appropriate course of action. It is important to remember that most cases of postcoital bleeding are linked to benign conditions, such as cervical ectropion, which is when the softer glandular cells from inside the cervical canal are present on the outside of the cervix. These cells are more delicate and bleed easily. However, regular screenings, such as pap tests, are designed to catch potentially cancerous changes early, often before any symptoms like bleeding appear. This is why staying up to date with your preventative care is so incredibly important. Ultimately, experiencing bleeding after sex should prompt a visit to your healthcare provider for evaluation. Early diagnosis, whether of a benign condition or a more serious one, ensures you receive timely and appropriate treatment, which is key to maintaining your long-term health and peace of mind. Taking proactive steps for your health allows you to address concerns promptly.